Like all doctors, I want to care for women in a genuinely compassionate way. In my work as a psychiatrist, I have met many women who have had terminations of pregnancy, some in very difficult and painful circumstances. Some describe it as a part of a difficult time in their past. For others, it has been the source of pain and suffering afterwards. I have not met any woman for whom it is an easy or a desirable choice. All doctors, regardless of our personal views on abortion, treat women in distress and with mental health problems with all possible care, and regardless of the outcome of this referendum, will continue to do so. In this referendum, we are being asked to vote on repealing the 8th Amendment, removing all recognition of the human rights of the unborn, and facilitating legislation for providing for termination. Much of the campaign from the Yes side is focused on cases of women whose lives may be at risk and who are also already provided for under the Protection of Life and Pregnancy Act 2013, women with pregnancies following rape, and sick unborn babies with life-limiting conditions. These situations account for around 3% of UK abortions. My sympathies are of course with the women in these cases. From my clinical experience, I understand the pain that such difficulties bring, and that these are complex and nuanced circumstances. However, due to my sympathies and my clinical commitment to these women, I have concerns about meeting their suffering with procedures and courses of action which are not proven to benefit women's mental health. If the 8th Amendment is repealed, the government are proposing legislation to allow unrestricted abortion up to 12 weeks and up to 24 weeks or viability if the mother's health is at risk, which may be due to physical or mental illness. In the UK, 97% of all abortions are carried out on mental health grounds. As a psychiatrist, someone who treats serious mental illness and has done so in the UK, it is not easy to believe that there are more than 180,000 pregnant women in England and Wales who are seriously mentally ill. Abortion on mental health grounds is a retrograde step and uses mental health problems as a reason for abortion rather than an indication for treatment. The mental health of women deserves real respect and real evidence-based interventions, but not at the expense of the life of the unborn. There is no justification for treating it as a mental health initiative. There is no evidence that abortion is treatment for any mental disorder, so it is unclear why the government would wish to legislate for this to become legitimate grounds up to 6 months. The proposed legislation suggests that a pregnant woman seeking a termination should receive an abortion if requested, but does not require that she actually receive appropriate assessment or treatment for the related mental health problem. A reasonable person would have to conclude that these mental health grounds are merely a euphemism for abortion on demand, social or non-medical grounds, ending the lives of healthy babies and healthy mothers. Let's not disguise abortion as a mental health treatment. Women with mental health problems deserve proper support and proper evidence-based treatments. They deserve mental health services that are appropriate and responsive to their needs and their human rights and the human rights of their children. Those in favour of repeal are rightly concerned for women's health, and this concern needs to be addressed with effective treatments that are proven to work. As a doctor, I cannot ethically accept or recommend any intervention which does not have an established benefit. It is hard to regard the government's proposal as anything other than a pretext to allow abortion up to viability. It would be a retrograde step for us to remove all constitutional rights from unborn human beings who are vulnerable and have no other protection than the 8th Amendment. As a doctor, as a psychiatrist, and as a woman, I will be voting no.